HIV stands for human immunodeficiency virus. Think of it as a very specific and persistent virus that targets the body's defense system. Our bodies have an amazing army of cells called the immune system that fights off germs like bacteria and other viruses to keep us healthy. HIV, however, is unique because it directly attacks the leaders of this army, a special type of white blood cell called the CD4 cell, or T helper cell. When these important cells are weakened or destroyed, the body's ability to defend itself against infections and certain illnesses becomes severely compromised. This is the fundamental challenge that HIV presents to the human body. The virus spreads from one person to another through specific bodily fluids. Blood, semen, rectal fluids, vaginal fluids, breast milk. This means it is most commonly spread through unprotected sexual contact, or by sharing needles used for injecting drugs. It can also be passed from a mother to her baby during pregnancy, childbirth, or breastfeeding, although modern treatments have made this much rarer. Narrator. When a person is first infected with HIV narrator, they may experience a short, flu-like illness. Narrator. This is known as acute retroviral syndrome. Narrator, or ARS, or primary HIV infection narrator, and it usually occurs within 2 to 4 weeks after exposure to the virus. Narrator. The symptoms can feel very much like a bad case of the flu. Narrator, or mononucleosis, which is why they are often overlooked or mistaken for another common illness. Narrator. Because these signs are so general and can be attributed to many other conditions, many people do not realize they have been infected with HIV. Narrator. These symptoms can include a fever. Narrator. A sore throat. Narrator. A body rash that isn't typically itchy. Narrator. Severe headaches. Narrator. And swollen lymph nodes, particularly in the neck. Narrator. Swollen lymph nodes. In the armpits. Narrator. Swollen lymph nodes. Or in the groin. Narrator. The body is essentially mounting its initial and ultimately unsuccessful fight against the invading virus. Narrator. During this early stage, the amount of HIV in the bloodstream is extremely high, making the person highly contagious. Narrator. The body's immune system tries to fight back, but the virus is incredibly efficient at replicating and targeting the very cells designed to stop it. Narrator. The symptoms of ARS might last for a few days or several weeks before they disappear on their own. Narrator. Because these signs are so general, many people do not realize they have been infected with HIV. Narrator. This is a critical window where testing is essential, as starting treatment early can lead to much better long-term health outcomes. A complete blood count, or CBC, is one of the most common and fundamental blood tests ordered by doctors. It is a powerful diagnostic tool that provides a wealth of information about the different types of cells that make up your blood. Think of it as a comprehensive inventory or a snapshot of what's happening inside your bloodstream at a specific moment in time. This test is not specific to any single disease but gives a broad overview of your general health. It can help doctors detect a wide range of conditions including infections, anemia, a lack of healthy red blood cells, certain types of cancer like leukemia. The CBC test measures the 3 main types of cells circulating in your blood: red blood cells, white blood cells, platelets. Red blood cells are responsible for carrying oxygen from your lungs to the rest of your body. White blood cells are the soldiers of your immune system, fighting off infections from bacteria, viruses, and other invaders. Platelets are tiny cells that help your blood to clot, which is essential for stopping bleeding when you get a cut or injury. The test provides a count for each of these cell types, as well as important details about their size, shape, and quality. Doctors use the CBC for many different reasons. Taking a complete blood count, or CBC, is a very simple, quick, and routine procedure that you have likely experienced before during a doctor's visit. There is usually no special preparation required from your side. You can typically eat and drink normally before the test, unless your doctor has specifically requested that you fast because other blood tests are being performed at the same time. The entire process of drawing the blood usually takes only a few minutes and is performed by a nurse, a phlebotomist, or another trained healthcare professional in a clinic, hospital, or laboratory setting. The procedure begins with the healthcare professional identifying a suitable vein, which is most often located on the inside of your elbow. They will clean the area with an antiseptic wipe to prevent any risk of infection. To make the vein more visible and easier to access, they will often tie an elastic band, a tourniquet, around your upper arm. You might be asked to make a fist to help pump up the vein even more. Once the vein is ready, the healthcare professional will gently insert a small, sterile needle into it. You might feel a quick pinch or a slight stinging sensation as the needle goes in, but this discomfort is usually very brief. The needle is attached to a special collection tube that has a vacuum inside, which helps to draw the blood out of your vein and into the tube automatically. Depending on how many tests have been ordered, they may need to fill one or more of these tubes. The process of filling a single tube takes only a few seconds. After the required amount of blood has been collected, the needle is withdrawn smoothly. The healthcare professional will immediately place a small piece of cotton or gauze over the puncture site and ask you to apply gentle pressure for a few minutes. Narrator: when the laboratory analyzes your blood sample for a complete blood count, narrator, it measures several key components and the results are presented with a reference range. Narrator: this range represents the typical values found in a large population of healthy individuals. Narrator: it's important to remember that these ranges can vary slightly between different labs and can be influenced by factors like age and sex. Narrator: for a healthy adult, a normal red blood cell count is generally between narrator 4.5 to 5.5 million cells per microliter. Narrator: these cells are vital for carrying oxygen, so a count within this range suggests your body is getting the oxygen it needs to function properly. Narrator: the CBC also looks at hemoglobin and hematocrit. Narrator: hemoglobin is the protein inside red blood cells that binds oxygen. Narrator: normal level typically 13.5 to 17.5 grams per deciliter for men. Narrator: and 12.0 to 15.5 for women. Narrator: hematocrit measures the percentage of your blood volume that is made up of red blood cells. Narrator: normal values around 41% to 50% for men. Narrator: 36% to 44% for women. Narrator: the white blood cell count is another critical part of the CBC. Narrator: a normal total white blood cell count typically falls between 4,500 and 11,000 cells per microliter. Narrator: the CBC also provides a differential, which breaks down the white blood cell count into its different types: neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Narrator: each of these cells has a specific job in fighting infection. While a CBC test cannot diagnose HIV, that requires a specific HIV antibody or antigen test, it can reveal important clues about how the virus is affecting the body. HIV's primary target is the immune system, so the most significant changes on a CBC report for a person with untreated HIV are often seen in the white blood cell count. Specifically, the virus leads to a condition called lymphopenia, which means there is a lower than normal number of lymphocytes in the blood. Lymphocytes are a type of white blood cell, and they are the main cells that HIV infects and destroys, particularly the CD4 T cells. A standard CBC differential will show a total lymphocyte count. In a person with advancing HIV, this number is often low because the virus is actively depleting these crucial immune cells. While the CBC doesn't give a specific count of CD4 cells, a low overall lymphocyte count is a strong warning sign for a doctor. HIV can also affect other parts of the blood, leading to changes in the red blood cell and platelet counts. Anemia, or a low red blood cell count, is very common in people with HIV, especially in the more advanced stages of the disease. Furthermore, HIV can lead to thrombocytopenia, which is a low platelet count. The virus can directly infect the bone marrow, or the immune system can mistakenly create antibodies that attack platelets. A low platelet count can increase the risk of bleeding and easy bruising. While the CBC provides a broad overview of blood health, the most critical test for monitoring HIV is the CD4 cell count. CD4 cells, also known as T helper cells, are the master coordinators of your immune system. They are the specific type of lymphocyte that HIV targets and destroys. A CD4 count measures the number of these cells in a cubic millimeter of blood. This number gives a direct and accurate assessment of how strong your immune system is. In a person without HIV, a healthy CD4 count typically ranges from 500 to 1,500 cells per cubic millimeter. When a person is first infected, this number begins to drop as the virus replicates. The goal of HIV treatment, known as antiretroviral therapy or ART, is twofold: to stop the virus from making copies of itself and to allow the immune system to recover, which is measured by a rising CD4 count. Doctors use the CD4 count to track the progression of the disease and to determine how well a person is responding to their medication regimen. When the CD4 count falls below 200 cells per cubic millimeter, the immune system is considered severely compromised. A person with a count below 200 is diagnosed with AIDS, regardless of whether they have had a serious illness. They are at a very high risk for developing life-threatening infections like pneumocystis pneumonia and certain cancers. Doctors will often prescribe additional preventative medications called prophylaxis to protect against these infections until RT can raise the CD4 count back to a safer level. Narrator: Understanding the relationship between HIV and the CBC test, narrator, is a powerful tool for both early detection and long-term management of the virus. Narrator, for someone who doesn't know their HIV status but is feeling unwell with vague symptoms like persistent fatigue or frequent infections. Narrator, a routine CBC test can be the first step toward a diagnosis. Narrator, if a doctor sees unexplained abnormalities on the CBC. Narrator, low lymphocyte count. Narrator, low red blood cell count. Narrator, low platelet count. Narrator, it serves as a red flag. This can prompt the doctor to ask more pointed questions about risk factors. Narrator, and recommend specific HIV testing which might not have been considered otherwise. Narrator, this early detection is absolutely critical. Narrator, the sooner a person is diagnosed with HIV, the sooner they can begin antiretroviral therapy, or ART. Narrator, starting treatment early when the CD4 count is still relatively high leads to much better health outcomes. Narrator, early treatment that leads to an undetectable viral load preserves the person's health and prevents transmission of the virus to others. Narrator, this concept, known as undetectable equals untransmittable or U equals U, is a cornerstone of modern HIV prevention. Narrator, for a person already diagnosed with HIV, the CBC remains an important part of their ongoing care, working in tandem with CD4 and viral load tests. Narrator, by keeping a close eye on all the blood cell lines, doctors can manage side effects and adjust treatment regimens if necessary. Narrator, knowledge empowers patients to take an active role in their own health care. Narrator, in conclusion, HIV weakens the body's immune defenses. Narrator, and the complete blood count gives a window into overall health. Narrator, their intersection is crucial. A CBC can show early clues of immune stress, which may lead to earlier HIV diagnosis. Narrator, for people with HIV, the CBC monitors wider effects in treatment, helps manage anemia and keeps the body healthy. Narrator, a simple blood test is a pillar of care. Narrator, initial flu-like symptoms of primary HIV infection. Narrator, long-term management with ART. Narrator, show why being proactive matters. Narrator, HIV treatment has transformed outcomes, now manageable with daily medication. Narrator, but the key is knowing your status. Regular checkups and testing if at risk are powerful actions. Narrator, get tested. Routine CBCs or HIV-specific tests are self-care and responsibility. Narrator, with accessible information and effective treatments, taking control of your health is achievable. Narrator, talk to your doctor, ask questions, get tested, your health is in your hands. Narrator, thank you for watching. Subscribe for more health explainers and links to resources are in the description.